a call for more money and action to staunch an opioid drug epidemic that has come back stronger and deadlier, even since countless pill mills were shut down years ago.
A report from Miami-Dade County's Opioid Addiction Task Force focuses on the devastating and costly effects of opiates like heroin and then new synthetics like fentanyl. Here's how deadly these are. 14 people die every day in Florida from an opioid overdose. More than 2,300 Floridians have died of opioids so far this year, and it's estimated some 5,300 Floridians are going to OD by the end of this year. That is more death than highway accidents or gunfire.
Russell Benford is the Miami-Dade deputy mayor, and he serves on that opioid addiction task force. We welcome him to the conversation this morning. Lisa Franklin is a clinical outreach coordinator who has overcome a personal battle with drug addiction, and she founded the Collegiate recovery community at the University of Miami. And Raymond Estefania is co-founder and executive director of Family Recovery Specialists and the former director of South Miami Hospital's Adolescent Addiction Treatment Program. That is where we begin the conversation today. Thank you so much.
Great to have you all come in.
Thank you. Thanks for having us.
Raymond, this crisis is not new to you or to anyone at this table, but to a lot of us, seeing these numbers as we did this past week are stunning. How did this crisis get so bad?
Well, you know, Michael, I think we all remember several years ago when we had the issue here in South Florida of the pain clinics.
Right.
A lot of the people that become addicted to heroin and other opiates, you know, started out
on Vicodin,
yeah,
Oxycontin.
Absolutely. They started out sometimes with a legitimate medical problem that needed, you know, they needed pain treatment, and we had this proliferation of pain clinics in South Florida that were just really handing out these substances, very dangerous addictive substances. Those are closed now, or at least most of them are, right? The federal government got involved and really took action against.
And the state government.
And the state government as well. But you know, a lot of those people that were seeking these substances in those pain clinics are now getting those substances on the street.
And how much more dangerous can that ever be?
Well, very dangerous, right? Because we're hearing in the news all the time about the overdose deaths, right? And, you know, heroin and things like that. This drug fentanyl that ends up, you know, getting sort of put into the synthetic drug that gets put into the heroin and sold. And you just don't know what you're getting, right? The person who's using it doesn't know exactly what they're using, and so it's very dangerous.
You know, you were just looking at some video, and maybe we can look at more of a Local 10 investigation into how first responders in South Florida find themselves in a position of administering anti-withdrawal drugs to overcome this addiction. Russell Benford, this task force that the county has come out with a report this week, highlight for us what, I mean, this was a deep dive by an impressive panel of health and social services people. What did you find?
It was stunning, Glenna. First and foremost, as you mentioned, with respect to emergency responders, we really focused on two things. First was for the folks that are addicted, treatment services. You know, we wanted to highlight what facilities. We have about 20 facilities in Miami-Dade County that are available to our residents.
And I'm sure in Broward there is a similar.
There's several more. And then the other half was really with respect to law enforcement. A couple of years ago, the state legislature increased the penalty for heroin and cocaine. So that if someone is arrested that's selling that drug, they can be charged with murder if someone dies from it. This year, the state legislature increased the penalties for people that are caught selling fentanyl and carfentanil to include manslaughter charges, and we're going to work to increase those penalties of murder as well. The folks that are selling this poison, we need to get them off the street, and we need to lock them up for a very long time.
Excuse me, Russell. Lisa, you have worked with our terrific reporter, Amy Viteri, who has done these reports, gone with EMTs out on the street, and we just saw video, maybe we'll see it again, of a couple who were in a car down by Jackson Memorial Hospital who simply went unconscious because they had taken heroin. Now, you know, when you see this, you kind of think to yourself, and there were children in the car, how can people do this? What is so motivating about the need for a drug that you put your own life at risk and put the life of your children at risk?
At the end stage of this, it's not, the obsession and the compulsion is such that you're not thinking about anything else, you're just trying not to die. And nobody uses with the intent of overdosing. They're just trying not to get sick. And that's one of the really great reasons that naloxone is so readily available. Same with the public health emergency that was declared. But I was in a situation even as soon as the 4th of July. I thought I was hit by someone, and they thought they hit me as well, so they pulled over. They apologized for driving erratically. They were just trying to find naloxone because the 2 pharmacies they had been to were not carrying it. I had it with me, and at that point I gave it to them. I gave them the Broward 211 list of local resources. So even at this point, with all the attention, it's still not as available as it needs to be.
All right. Naloxone is the generic name for, I guess the brand name is Narcan.
Narcan.
Is it not? I've read that this costs about $50 a dose. And the EMTs in Broward County, Miami-Dade County, City of Miami, every law enforcement department, every fire rescue department has just had to step up the amount of Narcan they administer every day. Is that right, Russell?
Yes, Michael. One of the things that's shocking is with respect to Miami-Dade Fire Rescue, in 2016, our fire department deployed Narcan 1,200 times.
Oh, wow.
That is 100 times a month, Michael, 3 times a day in Miami-Dade County. For 2017, we're trending a 20% increase in the use of Narcan by our fire rescue personnel. So we talk about the number of people that die every year. One important thing to look at is how many times we're administering Narcan and saving folks' lives. And those numbers are astronomical. They're continuing to grow.
Well, I have to say, Ray, what about these people who have overdosed a number of times and yet continue to use? What is the prospect for rehabilitation if they are taking heroin with fentanyl and just are living and get revived from overdosing and then they go back to use again? Well, how do you get them straight? How do you get
Michael,
them
treatment really does work. We know this. The problem is that a lot of these people, many of them can't access treatment. There's no funding for it. They've maybe been to treatment. They've exhausted. They don't have health insurance.
How about Medicaid? Can they get
Medicaid sometimes will cover treatment. I think there needs to be more funding for that as well. Treatment works. Listen, this is an illness. It's a disease, as Lissa said earlier, and people have lost control. They've lost their ability to really understand what's happening to them. Their brain has been hijacked. They just don't have the ability to make these decisions, and we have to provide them effective, affordable treatment that they can access readily.
And as we talk about exactly this topic, I just want to put an exclamation point on the end of a sentence here, is that when we talk about addicts, we're not talking about dark alleys with people who, shady characters. No, I mean, Lissa, I'm so floored that you are so public as coming out as such an advocate with your own personal experiences. Yeah. But the demographic of addiction to opioids is the person standing next to you wherever you are.
Oh yeah, it doesn't discriminate. And it's really easy when talking about it too to immediately go in to think of like the young adult heroin addict, but the #1 population overdosing and dying in Florida right now are the Medicare recipients. Whoa. So it's somebody's grandparent.
Older people are now overdosing?
Yep.
Well, where did they begin? With a pain medication for genuine pain, then they got into Vicodin or Oxycontin, and then they moved on from there?
I can't say that with certainty because each person is different. Absolutely.
Yeah.
And I can tell you, Michael, with respect to Miami-Dade County, the medical examiner provides data on the people who actually die from overdoses. In Miami-Dade County, the #1 demographic for users of the drug are white males, white non-Hispanic males between the ages of 25 and 35. They are 3 times more likely to use heroin as Hispanics, and 4 times more likely to use than African Americans. But as Alyssa said, one of the fastest growing demographics are seniors between the ages of 45 and 65. So it does affect everyone in our community.
Yeah. In May was when the governor declared opioids a public health crisis, and we will pick that up when we come right back into. We are back discussing Florida's opioid crisis, and Before the break, we talked about how the governor, Rick Scott, has declared a public health emergency in May, and that freed up some federal money. There's $38 million plus in the state budget now addressing this, but it appears, Ray, that most of that is going toward the prison system and anti-withdrawal and anti-addiction drugs for the prison system. Is that appropriate, and will that advance what the state is trying to accomplish?
Well, I think it certainly helps, but we need to really appropriate some funds for treatment too, for the general population. I mean, you know, in Miami-Dade County, if you don't have health insurance and you don't have resources, it becomes very difficult for you to access addiction treatment.
Well, that was part of the task force report. I mean, what does the county, Russell Benford, do with as far as funding and attention?
Absolutely.
Is there enough?
One of the interesting things, in 2016, our own Senator Garcia sponsored State Bill 12, which requires a coordinated approach to mental health treatment and substance abuse treatment. That goes into effect July 1 of this year. So Miami-Dade County has a plan. Mayor Carlos Jimenez has allocated an additional $1 million in his proposed budget to provide additional resources for the intake of folks that have mental health and the co-occurrence of substance abuse treatment facilities. But as you talked about, one of the big areas that we need to increase funding is treatment beds. So the county provides that through our Community Action Human Services Department, and there are 20 facilities in Miami-Dade County, including the Veterans Administration, that do provide those services. But as time goes,
enough beds?
There are not enough beds. As we talked about, you have thousands of users in Miami-Dade County. Yeah. So as time goes on, you will see an increase in funding dedicated towards treatment beds. And we talked about, as soon as people get that dose of Narcan, as soon as they enter a hospital, as soon as they encounter a first responder, the key is to be able to get them into a treatment bed right away so that they don't go back into the community.
And a lot of them, I'm sure, are going to resist. Lissa, you were a founder out at the University of Miami of the Collegiate Recovery Community, U-Recovery. Tell us a little bit about that and what you did and how successful you were.
U-Recovery is a collegiate recovery community, and what a collegiate recovery community is a peer-led group of students in recovery on college campuses. There's over 250 right now across the country, and actually this coming week there's a national conference in DC, but what it does is it provides a safe and supportive infrastructure within the university for students in recovery to have a normalized college experience while having fun, without the use of drugs and alcohol.
And you're working at FAU right now, are you not?
I work at Life of Purpose Treatment. We're an academically focused substance use disorder treatment center on FAU's campus. But traditionally, people have to stop going to college to receive residential treatment. And the way that our model is set up, you can attend college while receiving residential treatment.
Is there enough front end attacking this program? It seems like there's the money and the efforts are geared toward what happens when people are addicted, when people are, getting into trouble. Should there be, or is there, more front end, whether it be on the criminal side, attacking users or possessors or sellers of things like fentanyl, or people, I guess like your program, to stop people from even becoming addicted with awareness? Is there a front end that we're not doing?
Glenna, I think if you really look at what's going to solve the addiction problem over the long term, prevention is really key. We really do need to be doing more work on the front end with children, right? With adolescents, with teenagers. Yeah. We know that addiction is a developmental disease. These adults that are addicted at 40 and 50 years old, most of them became addicted when they were young, when they were teenagers. And unfortunately, not enough resources are being put towards prevention. A lot of parents, unfortunately, don't think this is going to happen to them. And so these kids, these teenagers, start experimenting with drugs when they're 14, 15, 16 years old. And then the parents often don't act until they're 25 and now they're addicted to heroin.
Yeah. Ray, you have worked with teenage kids with addiction problems. Is marijuana a gateway drug, or can some kids and adults say, yeah, I'm going to smoke some weed and that's it, and then they stop, or do they move on to more powerful drugs.
Michael, marijuana is clearly not heroin or cocaine. It's not as dangerous as some other drugs or as addictive as other drugs. But the marijuana of today is not the marijuana of 25 or 30 years ago. It is a different drug. It is more dangerous. It is more addictive. And the problem, again, goes back to with children. It's about brain development. When kids start experimenting with any drug at 14, 15, 16 years old, their chances of becoming addicted are much greater than if they waited until they were adults. So sure, adults can have a casual relationship with marijuana. It's been my experience that teenagers cannot.
Can I ask a quick personal question to you?
Sure.
Was your addiction that you overcame, did that begin as recreational drug use, or were you prescribed pills that you then became addicted to?
It was a little bit of both. It started as recreational alcohol use. I was prescribed opiates through various sports injuries in high school. But what got me to where I am today is my family support. I had access to a safe and supportive therapeutic curriculum and recovery support services post-treatment.
That's great.
Well, congratulations on your continuing recovery, and thanks for coming on and
Thank
being
you for having
so
us.
Candid. Russell Benford, always great to have you come on.
Always.
Thank you, Michael.
You were
Glenna.
a terrific
Thanks.
guest. Ray,
Thank you, Michael.
for
Thank you,
your
Glenna.
expertise.
Up next, we discuss the big news of the week with our roundtable. Stay tuned.